If you follow any kind of health or science news, you've definitely heard the words incidence and prevalence thrown around. They sound kind of similar, but they tell two completely different stories about a disease. One tells us how fast a problem is spreading, and the other tells us how big that problem is right now. And by the end of this, I promise you'll know exactly which is which.
So let's just dive right in with the central puzzle. What is the real difference between incidence and prevalence? You might have a hunch, but these terms have super specific meanings. And don't worry, we're going to break it all down using a really simple analogy so you will never, ever mix them up again.
To really get a grip on this, we're going to use a classic tool that epidemiologists themselves use to explain it, the good old bathtub analogy. It's a surprisingly powerful way to visualize exactly what's going on here.
Okay, so in your mind's eye, just picture a simple, empty bathtub. For our purposes, this bathtub represents an entire population of people.
Now imagine you turn on the faucet. That water pouring into the tub, that represents all the new cases of a disease that are popping up. And the rate of that flow, that is incidence. Okay, so at any given moment, if you were to look at the total amount of water that's actually in the tub, that's prevalence. It's not just the new water coming from the tap. It's all the water that's already collected in there. It's like taking a snapshot of every single current case, new and old.
And that's it. That's the core difference right there. Incidence is the flow, the rate of new cases. Prevalence is the pool, the total number of existing cases. It's kind of like speed versus volume.
So, now that we have that bathtub analogy locked in our brains, let's tackle some of the most common ways these two terms get confused. This is really going to help solidify the difference for you. All right, so the number one mistake, the one you see all the time, is getting them completely backward. People will say incidence is the total and prevalence is the new cases. It's an easy mix-up to make, but it flips the entire meaning on its head. And if we go back to our bathtub, this would be like saying the whole pool of water is what's coming from the tap. It doesn't make any sense, right? Remember, incidence is the flow, not the pool. Next up is the idea that these are just two fancy, interchangeable words. Since they're often reported together, it's pretty easy to assume they just mean the same thing. Not at all. As we just saw with the bathtub, one tells us how fast the problem is growing, that's the flow, while the other tells us how big the problem is right now, that's the pool. They're two totally different but equally important tools. Here's another little mix-up. Trying to tie incidence to outcomes like deaths and prevalence to just frequency. This confuses the start of a case with what might happen at the end of one. But nope, incidence is all about the beginning. That moment, a new case appears. It doesn't track what happens later on. Both incidence and prevalence are simply measures of cases, not the results of those cases. And finally, there's this idea that these terms are specialized, that you only use one for certain types of illnesses.
In reality, both of these terms can apply to any disease, and actually, their relationship tells a really interesting story. Think about the common cold. Its incidence is super high in the winter. The tap is on full blast, but its prevalence isn't huge because people get better fast, so the water drains out quickly. Now think of something like diabetes. Its incidence, the rate of new diagnoses, might be lower, but because it's a lifelong condition, the drain is basically plugged. So the prevalence, that total water in the tub, just gets higher and higher over time.
Okay, so we've busted the myths. But really, why does this distinction actually matter outside of a textbook? Well, because in the real world, each number tells public health officials something completely different about how they need to respond.
Incidence is all about risk. A high incidence means your personal risk of catching the disease is going up. It's a measure of how fast the threat is spreading right now.
Prevalence, on the other hand, tells us about the burden. It shows us how widespread a disease is in the community and how many people are currently living with it. This is all about the current weight on our society and our healthcare system.
So think about it like this. If you want to know if a vaccine is working, what do you look at? Incidence. Are new cases going down? But if you need to know how many hospital beds or treatments you need today, you'd look at prevalence. How many people are sick right now? See? Each number tells a critical part of the story.
All right, let's bring this all together into one simple, crystal clear takeaway.
Going all the way back to that first question, the correct answer is B. It's really that straightforward. Incidence measures the new cases, the flow, and prevalence measures all the current cases, the total pool. If you just remember that, you've totally got it.
And seriously, if you ever feel yourself getting confused, just come back to our bathtub.
Incidence is the new water flowing in. Prevalence is the total pool of water already sitting there. It really is that simple. So the next time you see a headline about the rising incidence of something or its current prevalence, you'll know exactly what they're talking about. You can ask yourself, is the problem spreading faster, or is the long-term burden on our community growing? You now have the tools to understand the real story hiding behind those numbers.